Hello, this is Dr. David Greene, CEO of the Washington Pain Network. Today's topic is the basics of disc bulges and disc herniations. The normal intervertebral disc consists of 80% water along with 20% collagen and proteins. There are two areas of the disc, and it's similar to that of a jelly donut. So the inner part of the donut is called the nucleus pulposus. It's gelatinous and it has no nerve endings. It doesn't feel any pain at all. The outer part, however, of the donut is called the annulus fibrosus. It does have some nerve endings, so it can feel pain. Okay, the disc is a great shock absorber. When we bend, jump, twist, and rotate, water comes in and out, and it's really good for helping with range of motion. Disc degeneration occurs between the ages of 20s and 50s due to a number of factors. This may include obesity, smoking, repetitive trauma, genetics, or their social and environmental factors. This can lead to loss of fluid in the disc, which then could lead to loss of height in the disc, such as you see here. And you see the bulging, almost like a flat tire, a tire getting flat. Okay. So, and you can get tiny tears or cracks in the outer layer of the disc, the annulus, and that can be painful. So when you start getting, this is an MRI where you see white here, that's water, white, and then a black disc disease. So it's a dark disc, it's losing water, and it's starting to bulge. Okay. Interestingly enough, 35% of those between the ages of 20 and 40 have this kind of looking MRI with degenerative disc disease and no back pain at all. So just because it's there on the imaging studies doesn't mean that it's going to cause you any pain. So the way a disc herniation occurs is here you have a normal looking disc with the nucleus and then the outer layer, the annulus. Okay, then you can start to get a bulge because you have a incompetent annulus that starts to degenerate. All right, then you can actually get a tear in this outer part, the annulus, and the disc can come out. Okay, so that's a disc herniation. In and of itself, it's not always painful, but when it hits the nerve root and causes inflammation, that can cause a lot of pain, called sciatica. Other names for a disc herniation would be slip disc, herniated nucleus pulposus, prolapsed intervertebral disc, herniated intervertebral disc. They all mean the same thing. The symptoms of a disc bulge and herniation: most disc bulges don't cause any pain, as mentioned. But if it does cause pain, it can cause back pain. If it's inflammation in the area that reaches the nerve root or adjacent, it can cause sciatica. It can also lead to spasms and aching. When it does hit the nerve root and inflammation occurs, it can cause sciatica with burning, searing pain. It can include pins and needles along with some numbness. It can cause some motor weakness, such as inability to lift up your foot. And then rarely, it can cause incontinence. That's actually a surgical emergency. So treatment of a disc bulge and herniation, oftentimes it's benign neglect. Just watching it. If the pain is tolerable, then you don't really have to do anything about it. Over-the-counter medications can be non-steroidal anti-inflammatories, Tylenol. Physical therapy can be very helpful to moderate the pain, along with chiropractic treatment. There's a treatment called spinal decompression therapy that involves computerized intermittent traction. That can be very helpful. Over 85% in one study showed good to excellent results. Prescription medications, once in a while you can do a Medrol dose pack, which is a high-dose prednisone by mouth over a 5-day period. That should not be repeated very much at all, as it could be have some complications. Narcotic medication, along with non-narcotics like tramadol, can be very effective. Muscle relaxers, neuropathic medications, and those are your Neurontin and Lyrica. And then topicals. Topical pain creams have been shown to be very beneficial. When it comes to interventional treatments, trigger point injections are subcutaneous injections that can be excellent for muscle spasms and aching relief. Intradiscal injections, there have been several studies looking at this. Steroid injections can provide months of pain relief when injected into the disc. There's also regenerative medicine injections, which are becoming much more popular, and this can include stem cells, either bone marrow derived or fat derived, or amniotic derived stem cells are now showing excellent results into the disc. Epidural injections, such as you see here, this is a transforaminal injection. You see how it's the nerve root as it comes out is getting pinched by this disc herniation. This is where the needle goes for a transforaminal. It can be very beneficial for pain relief. It can be done as a series. Over 75% of individuals with degenerative disc and symptoms are able to avoid the need for surgery. So 3 out of 4. Out of those with sciatica symptoms, from a pinched nerve or irritation from annular tears, over 95% are able to avoid the need for surgery. So the odds are in your favor if you're dealing with sciatica. A landmark study in 2006 showed that the outcomes of disc herniations at 1 year are no different than they are for discectomy. So non-operative treatment is the way to go if possible. The top non-operative pain management in Washington is through the Washington Pain Network. There's multiple affiliated clinics throughout the state offering over 25 treatments, accepting over 50 insurance plans. The average success rates are over 90% with the board-certified, award-winning doctors. Visit us online today at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Washington Pain Network. Your pain stops here.